Hey y'all, I'm Dr. Erin. I just joined here at Active Spine Center and I brought a really fun intervention with me. It's called dry needling. We're really excited to talk about it with you guys, and there's lots of different applications for this, so we're going to go over one of them. So even your doctors receive this treatment whenever they can. Dr. Joni here has been getting it for her elbows because, you know, with us working on y'all, we use our arms a lot. So why don't you go ahead and tell them what you've been feeling?
Just a few months ago, started having some achiness in my lateral epicondylitis, and it has not seemed to go away. I have it in both arms, so she's been working with me on a few visits here.
So with Dr. Joni, we're going to be working on her lateral epicondylitis, also known as tennis elbow for those who know. What we do is we will take the appropriately length needles for the area, and for her, we're going to use some shorter length ones because we're just going into the arm there. Not too much cake in there. And we are going to go as close as we can through the muscle all the way to the bone to get all the muscle layers. So when the needle is inserted, what happens is the muscle might jump or almost have something like a spasm feeling, and that is going to be releasing the lactic acid that is holding the trigger point together in the muscle and helping it relax. And you might feel some tightness, you might feel some soreness, but it always relaxes after they're out. The goal with dry needling is to create some sort of a micro trauma in an area that's got some chronic inflammation to restart the inflammation process, because as we know, we need inflammation for our body to heal. But we want to start a new process without fully injuring ourselves. Like, we're not going to break her elbow to get it started. We're going to put these little needles in, create that micro trauma so she can get up and use her elbows after we finish. When you're getting needled, how would you describe the sensation?
It's not bad. It is, in the elbows, it's a little intense just because it's such a small area, I believe. And but once you sit there, once they're in, you really don't feel too much. So it's fairly comfortable.
All right, so we're going to get Dr. Joni down on the table and set up for needles, and see you then. So I've already cleaned up the area with alcohol, and I'm starting off with some 1-inch needles closer to the elbow. Something you might not think about is that the origin of a lot of these elbow muscles starts up higher in the arm. So we're going to go throughout the arm to address the elbow. All right, we are going to start taking her needles out. It's been about 10 minutes, so we're going to see how she's feeling after. So how do you feel now that the needles are out?
Needleless.
All right, how do your elbows feel now that the needles are out?
Truthfully, maybe a slight little achiness, but other than that, when you've done it before, I just jump right up and start adjusting. So really, they feel pretty good right afterwards.
A lot of people will often feel some soreness that's kind of different from the pain they started with, and that generally relaxes after the first day or two. So even if you're not one of my direct patients and you're one of Dr. Kriz or Dr. Smith's patients, I'm still happy to see you. And anybody else new, I'm happy to take you. I'm excited to meet you all and excited to get some dry needling in Brevard County.